Cocaine is an alkaloid derived from coca. The dried leaves of the plant Erythroxylum coca. It is a colorless, crystalline substance having a bitter taste. It is a recreational drug of choice for the modern affluent class of person. Coke, crack, crystal, free base are different names given to the same preparation with a slight modification and different stages of purity. The common routes of administrations are chewing, application to nasal mucosal membrane, snorting, smoking, and intravenous injection. Cocaine is said to reduce appetite and feeling of fatigue. It is commonly used as an aphrodisiac or pleasing intoxicant. Drug addict use it as a snuff, either pure or mixed with boric acid. Symptoms and signs: cocaine first acts as a stimulant, then a depressant of the nervous system. The psychoactive effects are due to action on the neurotransmitter sites by production of dopamine, which goes to the pleasure center of the brain. The stimulant stage is characterized by dryness of the mouth, bitter taste, euphoria, increased physical and mental energy, stimulation of the libido, restlessness, excitement, and delirium may appear. Patient become maniacal and may have hallucination. Other physical effects include flushed face, dilated pupil, blurred vision, tachycardia, hyperthermia, and increased respiratory rate. Toxic dose will produce incoordination, muscular twitches, and convulsion. This is followed by a stage of depression, which is characterized by feeble respiration and collapse, ending in death from respiratory or cardiac failure. Myocardial ischemia and infarction is due to coronary artery constriction is seen in some cases. In fact, cocaine is so hard on the body that is often mixed with heroin to dampen it. It's a harsh effect. Combination is called a speedball, can be deadly. A crack house is a euphemism from a place where a crack cocaine is sold or smoked. Like the shooting gallery of heroin, it is a place where people meet to enjoy cocaine and transact illegal activities in relation thereto. Fatal dose: the ordinary fatal dose is 1 gram orally. The fatal dose after application to mucosal membrane may be as low as 30 mg. The drug being rapidly absorbed by the root. A fatal period: death usually occurs in about 2 hours. Treatment: if the drug is injected, absorption should be limited from the injection site per tourniquet. If applied locally to the nose or throat, it should be removed by washing with warm water or normal saline. If swallowed, the stomach should be washed with a dilute solution of potassium permanganate or organic acid. Medicinal charcoal may also be employed. Excitement should be controlled by barbiturate or diazepam. Cardiorespiratory stimulant and artificial respiration may be required. Further treatment is symptomatic. Postmortem appearances: death being due to asphyxia or cardiac failure is a sign of severe form of death are likely to be found. Cocaine is largely destroyed in the human system, and it is difficult to detect it by chemical analysis. Chronic cocaine poisoning: sense of well-being experienced on administration of cocaine causes a number of persons to drift into addiction, also known as cocainism, cocainophagia, or cocainomania. The tongue and teeth of the habitual cocaine eater are black. When cocaine is used as a snuffer, there is generally ulceration of the nasal septum. The symptoms of chronic cocaine poisoning are characterized by anorexia, loss of weight, weakness, tremor, impotence, moral deterioration, and insanity. The effect of cocaine lead to increased erotic tension in the woman and nymphomania. In men, the condition leads to many sexual perversion, mainly homosexuality and libidinous. Drug not advised to be avoided in treatment of cocaine poisoning: beta blocker, coronary artery spasm is the adverse effect, especially propranolol, paradoxical hypertension. Lignocaine and procainamide, convulsions. Quinidine, arrhythmia. Haloperidol, droperidol, hyperpyrexia. Phenothiazine, convulsion. Drandrolene, cardiac insufficiency. Bromocriptine, coronary artery constriction. Aspirin, thyrotoxicosis, thyroid storm, outrage. Insanity is characterized by many delusion of persecution, hallucination, chiefly tactile and visual. Magnet symptom: the feeling as if grains of sand are lying under the skin or small insect cocaine bugs are creeping on the skin. Formication is the most characteristic tactile hallucination. The principles of treatment for abuse are the same as that for any other similar drug. Bromocriptine by mouth 0.625 mg 6 hourly reduces craving for cocaine and counters withdrawal symptoms also. Magnetism: the cocaine addict is trying to squeeze out the swan particles from under the skin. The cocaine addict is disturbed by feeling of insect cocaine creeping on the skin. The cocaine addict is looking for cocaine bugs under the pillow. Cocaine, skin popping, scar. Medical legal aspect, body packer, X-ray scan, drug capsule. Cocaine is a drug of use and abuse and produces physical and physiological dependence. Poisoning is due to its use either as a recreation drug, an anesthetic, or an aphrodisiac. It has been used as a local application to the glands to increase the duration of the sexual act. Urethral injections are especially dangerous. Prostitute ingest a solution of cocaine into vagina. This gives the individual sense of local constriction and extreme systemic exhilaration. Injecting cocaine with the unsterile equipment can transmit AIDS, hepatitis, and other infections. Body packers who smuggle cocaine by intracorporeal route wrap cocaine in plastic bags or swallow or insert the drug in body orifices. The packages may break and large amount of cocaine may be spilled with a fatal result. The Spanish police caught a woman smuggling more than a kilogram of cocaine had an insert implant in her breast. The woman had 2 breast implants containing cocaine implanted in her. She had 2 open cut under each of her breasts. Thank you.